I went to Northwestern Medical School. As a Hyde Parker, I had to explain it was just downtown. It wasn't in Evanston. But it was a wonderful education. But one worry I might have had has been abated by the fact that the school was in the careful, courageous leadership hands of Ray Curry, a dean at that place. So I sleep comfortably at night knowing the school is in good hands. He's our next presenter, and Ray, I have to say as he comes up, is more than just a dean at Northwestern, important as that is. He's a very self-aware about the importance of social medicine, and he does a great deal to make the students at Northwestern have a complete education. Ray, are you in here?
Yes. Thank you, Gwen. That's most gracious. I do have to turn that down one notch by saying that I'm not the dean at Northwestern. I'm the education dean, which means that I'm not responsible for absolutely everything that happens there. I'm here tonight to introduce Judy PankoReis as a representative and as the leader and the engine behind the Women with Disabilities Center at the Rehabilitation Institute of Chicago. The RIC Women with Disabilities Center was founded in 1991, thank you, by the young Dr. Susan Rayner, who is now the Chief Executive Officer of Schwab Rehabilitation Hospital, and the young Dr. Christy Kirshner, who, for those of you who may not know, and I'm obliged to tell you by the ethos of full disclosure, is now my wife, and still the young Dr. Christy Kirshner. Though I might submit that that's arguably not as problematic a relationship as sharing Cubs season tickets. The center was begun really with the simple notion of providing physical access to basic medical and gynecologic care for women with disabilities who, for example, might not be able to be accommodated by most physicians' examination tables and the like. But very soon, with the hiring of Judy as executive director, it became much, much more. It grew to involve such things, and I'm sure I'll miss some of the programs, I'm sorry, as a peer counseling program, women with disabilities helping teenage girls who are disabled understand how to make their way through life. With a domestic violence program specific to the problems and the circumstances of disabled women. There is a newsletter with a very broad distribution called Resourceful Woman. You can find it on the RIC website. There has been a video, an award-winning video, helping health professionals learn how to work with people with disabilities most effectively. There's been a monograph called It Takes More Than Ramps, focused on access for people with disabilities. It was in fact cited by the Surgeon General in his 2005 report on healthcare access for people with disabilities. And I've probably missed 2 or 3, but I'll hold it there. On the medical services side, they've also expanded to where there is a level of expertise among the group, including the gynecologists from Northwestern that work with them, in guiding women with physical disabilities through pregnancy, and a series of nearly 50 women with severe disabilities who have successfully, many of them were told by their physicians they would never be moms through successful pregnancies. You may have seen the Chicago Tribune magazine just a few weeks ago highlighted one of those women on its cover. So this has grown again from that very simple idea to, I think, is a unique resource in this country and perhaps around the world.
son Louis said, "Keep it short, Mom, keep it short." And Margie said, "Take as long as you want." So I wanted to thank Ray, and the person that really belongs up here with me is Christy Kirshner. She's my other half when it comes to healthcare access and policy for women with disabilities. Christy, raise your hand. I want to congratulate my fellow awardees, many of whom I've had the pleasure and honor of interacting with over the years. I think it's important for you to know that even though we are expanding beyond the walls of the RIC, the Rehabilitation Institute of Chicago has provided a wonderful forum for women with disabilities and our healthcare providers. I mean, basically, they've given us a forum to practice our mantra. This is a mantra I want you to remember whenever you're dealing with healthcare for people with disabilities. Nothing about us without us. Nothing about us without us. I mean, the RIC is one of the few, if not only, rehab hospitals in the country that was ever able to really exemplify and put that type of mantra into living practice through the RIC Women with Disabilities Center. So when you're thinking about how can you make your clinics and your healthcare settings more user-friendly and welcoming for people with disabilities, women with disabilities, getting that equipment that needs to be accessible, with accessible scales, just give us a call. Come to Christy, come to me, come to Health, Medicine, Policy. Go to Heartland where they're doing it right. Go to the Chicago Women's Clinic where they've been working with us for years. And just remember that when you get us involved, you will find that the quality of your healthcare will improve tremendously. I brought a copy of my newsletter. You can read more about the activities and the integration efforts that we have in place, moving our clinical services into an integrated community setting. You'll recognize our newsletter because it's the only one with a group of women with disabilities and a rehab hospital meeting with Barack Obama.